Good morning, everyone. Happy Monday.
Good morning, Borsika.
How are you, Kathy?
Good.
Good morning.
Hi, Russ.
So Borsika, I'm assuming you're gonna lead at least the first part, and then we'll see how long that takes and where we're at, and then we can just kind of play off each other and help with the more open-ended thing after that.
Great. If that works for you, Russ, I thought that we would do that. Kara has some of usual kind of intro slides,
Sure.
and we will start the mini presentation, have some discussion, and then open it up.
That's perfect. That's perfect.
Good morning, everyone. We will wait a couple of more minutes and we'll get started. Hope that you all are doing very well. Another week. Good morning, everyone. Thank you so much for joining. We are gathering still. I think we will wait a couple of more minutes. I know that it's an early time, at least here on the West Coast. I hope you are all starting a good week. And perhaps I will just say that today we have a couple of plans, and Russ and I will be co-leading the session, but the first part will be a small presentation with a group of guest co-editors of a special topic issue around adaptations. And I will very briefly introduce ourselves because I'm part of this guest editor group. And then we will talk a little bit about the special issue that we invited you to participate in a few months ago, and now we are done with it. So it's ready for you to enjoy. And so we will share a little bit of information about what kind of publications emerged from the topic invitation, and share a few themes that also emerged and potentially set stage for future publications for understanding, documenting, and assessing adaptations. And in the second half of this call, we hope that we will open it up for a broader discussion for all of you to share what are you up to. We have not done this in a while. We would love to hear of any kind of activities that you are undertaking right now that align with Fidelity, Adaptation, and Tailoring. And so that is our main plan for the second half, to hear from you. And so the first section, again, is this discussion about the special topic. Kara, you have to remind me if we have any other slides before we jump into the first agenda item. Yes. So we have, we continue our monthly seminar series in June. And I am very excited to say that Dr. Thomas Engel is going to join us and talk about his recent publication on common elements, approaches to implementation, research and practice, methods and integration with intervention science. You can see the link there. Please try to come and read the publication before, if you can. We are going to take a break for the summer in July and August, but we will reconvene on September 11, 2023. And we are still open to decide who will be presenting that day. So if you have something that you would like to present in September, please let us know soon. And we have a few topics that are in the waiting, but if you have something that you feel is ready just in September, please let us know. And there is a form there, and you can also use a QR code if you want to submit either a topic that you are interested in learning about, a publication, or if you would like to nominate yourself to present in September or later. Thank you so much, Kara. We can go to the next slide, I think. Yes. So we have been invited, and actually Roman was the one who was invited, and then she gathered a very nice team of guest editors for Frontiers in Health Services Research and Public Health to put in a joint research topic around adaptations, and specifically looking at how adaptations can be documented, how can adaptations be made, especially during implementation, and how you can assess adaptations. And so the four individuals who co-edited this special topic were Dr. Roman Ayele, Dr. Kathy Battaglia, Marina McCreight, and myself. And you can see our affiliations and specific roles in these different organizations. All of us, four of us, work together as part of the VA query that is led by Kathy Battaglia in Denver around the quadruple aims. And all of us play different kinds of roles, but in some ways linked to implementation science. And then another partner of ours in this joint endeavor is actually Raz Glasgow, who was also very important in the early initiation of this special topic. And I think I'm not going to spend time to individually go through the wonderful accomplishments of all of the other guest editors, but I will let them, as they come on, share anything that they feel is critically important for you to know. And with that, I would say we have a very brief presentation, perhaps, I don't know, 20 minutes or so, and then we'll open it up for Q&A to introduce you to this special topic issue. And I think Roman is going to start us off.
Yes, thank you for the introduction, Borsika. I'm going to share my screen for this. Can you see my screen?
Yes.
And hear me okay.
Right. Yep.
All right, great. Hello, everyone. Good morning to you all. So a few months ago, we came and talked about the call for papers, understanding, assessing, and guiding adaptations in public health and health systems interventions, current and future directions. The call was on Frontiers in Public Health, the Public Health Education and Promotion section, as well as Frontiers in Health Services Implementation Science section. And we were really asking you all to participate and submit papers if you had any. And so we wanted to come and give you guys updates about what we have gotten so far and how it went. And as Borsika mentioned, here is our editorial team, and feel free to put any questions you might have in the chat so that we can answer them as we go. So just to review a little bit of background, adaptations or changes to an intervention and implementations are inevitable as we implement interventions in real world settings. It is really important to understand what adaptations were made, why and when adaptations were made, and with what impact. And making sure that we systematically document and assess adaptations across the life cycle of a program. Although a lot of the methods are evolving, we have several questions we really wanted answered in this call for papers. The research topic questions that we put out were what aspects of an intervention and implementation strategy can be adapted and to what extent, and who decides these adaptations? What are some pragmatic approaches to documenting adaptations? How do we assess the impact of adaptations on implementation and effectiveness of outcomes? And how can we use real-time information about adaptations to guide improvement? How do contextual factors influence these issues? And then how can we meaningfully involve stakeholders in these activities? And so with these research topics in mind, the special issue topic focus was on, we really went very broad and said we want to see some conceptual models, research designs, and assessment approaches addressing documentation and evaluation of adaptations, research studies representing diverse contexts, including different countries, cultures, types of settings, and temporal contexts of early, mid, and late program adaptations, diverse types of adaptations, so it could be to the intervention, implementation strategies, or context itself, and examples of engaging stakeholders in the creation, assessment, evaluation, and guidance of adaptations. And we really welcomed contributions from multiple disciplines, and especially transdisciplinary work, including public health, health services research, psychology, economics, medicine, anthropology, and social work. We wanted to see those in the special issue topic that we put out the call for. And Marina will give us an overview of papers in the special issue.
Yes, thank you, Roman, and good morning, everyone. So in terms of geographic area, we had quite a variation here. We have most of the papers came from United States, but we did have a few of them come from Europe and from South America and Canada here. So we have one manuscript from Canada, one from Chile, one from Guatemala, and one from Sweden. And this included both the research teams located in those countries and also the work that's been done specifically in those countries. Next slide, please. In terms of the topics addressed, we had quite a variety here as well. There was topics of care coordination between multiple healthcare settings, also the adjusting the curriculum, the training curriculum for healthcare providers, considering how human-centered and cultural factors impact or influence and form adaptations, also adaptations to implementation strategies. Another topic was, maternal child health was a center topic of one of the manuscripts. Multidisciplinary care and mental health. We had several manuscripts addressing that, specifically the diagnosis of schizophrenia and first episode of psychosis, as well as mental health and depression in youth. There were quite a few addressing the COVID-19 pandemic and other public health emergencies. Also social risks and social needs in healthcare and adaptations needed to, and how those inform adaptations. And finally, the women's health. We also had quite a variety in the setting where this work was taking place, was clinical, community, and there was a manuscript address in both, as well as multi-level settings such as state and system and individual practices. In terms of the population, there's a number of manuscripts addressing the needs of a general focus on the needs of general population. There was a few, as I mentioned, addressing the women and women health, such as low income and then veteran women who are veterans, also youth and clinicians and healthcare staff. A few manuscripts addressed the policymakers and, as I mentioned before, in the state level specifically, and also multi-level stakeholders and partners that are engaged at the national, state, and local levels. and then also looking at the patients and caregivers and adaptations addressing their needs. In terms of which adaptation method was described in the manuscript, we also had quite a variety there. There was a number of manuscripts addressing how do we identify adaptations and how do we track them and report them. Also, how do we assess impact on implementation outcomes and assessing the economic implications of adaptations that are taking place. As I mentioned, documenting over time and using multiple sources of data for adaptations during the implementation. And also, how do we specify and report on the adaptation, as well as how do we implement them and carry them out during the implementation. And there's a couple of manuscripts addressing the rationale for cultural and human-centered adaptations. We also had quite a variety of theories, models, and frameworks that were reported in this manuscript. Adapt, ITT, Adaptone, CIFER, also Frame and Frame-IS, I would say probably was the most commonly used. And then a number of manuscripts reported on MADI and Rapid Cycle and REAIM and Iterative REAIM framework. And in terms of categories of adaptations that were made, many of them were made as a result of COVID-19, which is not surprising. And then, there were also adaptations reported to promote health equity. There were adaptations that were taking place during the implementation process, iterative adaptations. And also, there were reports of adaptations that were informed by the context, by the stakeholders' feedback, and also specifically centering on human and cultural factors. And there are examples of adaptations that were made to healthcare delivery, to the format of an intervention or program, adaptations to program components, and as I mentioned, adaptations to implementation strategies that were taking place. And I believe next, we'll talk about the impact.
Hi, this is Kathy. I am pleased to show you a couple of figures that have described the impact that we've had in the special issue. And so, as Roman had stated earlier, we started to look at papers getting published in 2021, and you can see the different colors, that rust orange color being views of articles. So you can see the biggest impact of that over the last year. And then that's figure on the right-hand side shows each of the month and the growth that we've seen. But basically there's been almost 17,500 views for all of our articles. And so quite proud of that. And then the next slide, Roman, just shows the map of where some of these views and people searching for topics around adaptation. So you can see in North America, mostly about 1,200 of those views came from North America, but you can see quite a wide breadth of interest in this topic across the world, really. So really exciting to see this, and it'll be nice to watch it grow as the special issues get actually published. So that'll be nice. Okay, so I think Borsika is going to wrap it up with the next few slides.
Thank you so much, Kathy. So I wanted to give you a kind of a sneak peek of a perspective paper that we were lucky enough to get from Dr. David Chambers, who reviewed the publications in this special topic and identified some main themes. This one is, I put it in the chat, we had a total of 21 articles, one perspective paper in addition to that, and then our editorial. And I am hopeful, because they usually send this through relatively quickly, that both the perspective paper and the editorial will be available by the end of this week. They are in the final kind of preparation stage, so you will be able to access them. But I did want to give you a few highlights that Dr. Chambers identified in his perspective. And those really aligned with what we have seen through our kind of review or content review of our papers. So one of them was this importance of focusing on theories, models, and frameworks, and seeing that these publications, many of them, relied on multiple different types of theories, models, and frameworks. And as Marina mentioned, very often it was some variation of the frame or frame-IS. Sometimes it's a REAIM expanded version of it, MEDI, but then there were some cases where it was more of a traditional like CIFR or REAIM PRISM that are used for documenting adaptations and guiding adaptations. The other piece that was highlighted is this notion that intervention adaptations occur throughout the implementation process. So our early stage thinking or adaptations was, we make adaptations pre-implementation, and then as we go into it, the implementation will be clean, and we are going to stop making changes because that would mess up designs. What we saw in this paper is that that is not the way the literature is describing adaptations these days. They are definitely highlighting the opportunities to make adaptations as we move forward during implementation and during sustainment. I also would like to highlight another point that Dr. Chambers made is the importance of partnerships. And these partners are often very diverse in the sense that they represent patients, clinicians, community members, administrators, policymakers, and they inform what should be adapted and how it should be adapted. And so that kind of identification of lack of alignment or fit and what needs to happen to increase that alignment and fit as we go along, as context changes, it is always informed by partners or should be informed by partners. And finally, there is an increase in the volume of empirical data, which we are looking to get about the use of different types of adaptations and their impact, although the measurement of impact in a quantitative way is still relatively low. So if we go to the next slide, a couple of additional highlights that Dr. Chambers made for considerations for the future or moving forward in terms of, again, understanding, assessing, and documenting adaptations. One is this, again, this change. It's almost like a paradigm shift. I would use that word, that as we think about adaptations, we went from thinking of them as preconditions to implementation to understanding adaptations in the context of implementation. And I thought that that was just a really nice way of saying that we are now not expecting that things will be stagnant. And I just want to highlight that Dr. Brian Mittman is with us, and he has done some really nice work in thinking about how adaptations should be documented, assessed, and acknowledged instead of suppressed through his work in the methods panel for PCORI and in other ways. And so, Brian, I hope that you can share a little bit about what work you are doing in this area these days. Also, there is a complexity and nuance in the improvement of fit between the intervention and the context. I think that that is clearly coming out on a number of articles that were in this special issue, thinking about ongoing iterative adjustments. The importance of ongoing adaptations, again, that was mentioned multiple times, but I want to again highlight that there is a dynamic setting and dynamic needs that we have to adjust to, and that is newer in the field, to acknowledge that. Again, we'll go back to having Dr. Brian Mittman here, and I don't know if Monica was able to join us today, but this idea of form and function and the distinction of those in interventions, and I would say even recently, Monica has been thinking about, in implementation strategies and helping guide what should stay stagnant, what we should maintain with fidelity, and what can be changed. Ongoing learning about adaptations throughout the implementation process, the need for develop a taxonomy of adaptations to guide both adaptation research and practice. And finally, Dr. Chambers returned to his earlier publication around the adaptome, the notion that we can have a database that starts to make us understand how adaptations are made in different contexts and their impact. And so he felt that this special topic and the field is moving in the direction of generating information that could feed into this future adaptome. So with that, I'm going to close this presentation and invite you all to share thoughts, questions, or any other things. And I think we can Roman kindly provided her contact information to contact her if you have any questions, and feel free to contact any of us so she's not overwhelmed with requests. Thank you so much. And again, please ask any questions. I was looking at the chat and I haven't seen too many yet, although I'm going to start to read them. Okay, so I will take one because I see one and then I will let others jump in. Elizabeth, thank you so much for the question about taxonomy of adaptations. This is again a future direction that Dr. Chambers suggested in his perspective. So one thing I would say that stay tuned, it's going to be available by the end of this week, hopefully, and you will be able to read more. The general idea, I think, here from my perspective is that we are talking about adaptations in more sophisticated ways. We talk about, planned, unplanned, the thinking about the different kinds, the timing, etc. And it seems like there is a need for us to start to develop those terminology. So as we write about these issues and we measure them and we assess them, we start to use common language, which again is a theme for implementation science in general, but it is relevant for adaptations as well. Great question. Let's see. I see some. Okay, I am going to try to manage some of the chat comments, but if Kathy, Roman, or Marina, you see anything that you want to grab, please do.
So Borsika, it's Brian. Could I chime in and read the question that I just posed? So, I think for those of us working in this area, the question is, from this collection of articles, is there, any emerging consensus? Or, as I said in the chat, are we still closer to the let 1,000 flowers bloom approach where, lots of different approaches and perspectives?
I will say something, but I would love to hear from the other guest editors as well, especially Marina. You read in greater detail all of the publications because you created the synthesis. My sense is, Brian, that there is still this, I love this, let 1,000 flowers bloom. I think there is still a lot of diversity in terms of how people approach this. One thing that I think that, so for example, Russ and our group has been working on doing iterative adaptations. And so we are starting to develop a way that we are doing those, but it's our way. Now we have done it in multiple studies, and there are a couple of publications in this issue and elsewhere where we have used similar methodology guided by PRISM, which is the context expanded version of REAM. And so we are developing this method, but other groups are using slightly different approaches. So I don't think there is, I did not see any consensus emerging at this point.
And I just want to echo that. I agree, Borsika. I think the context where the adaptations were taking place, that really informed the method and the data that was collected and how they're presented is, like thinking of a healthcare setting when we can pull data from EMR so easily and, and kind of understand that versus the community context, when we're dealing with, schools maybe, and local health departments and so forth.
I think Russ has a question.
Yeah, if I can just jump in there, I'd love to also just hear from others if you see other things, maybe even outside of this collection of articles, anybody about more consensus evolving. I guess from my perspective, I think there is acceptance, Brian, of the thing you and others have led that we need to look at these adaptations that do occur, whether we like it or not, may be positive or negative. I think that's pretty well accepted. I'm not sure. I do see some movement, not only, as Borsika said, our group, but others, in terms of thinking about this notion of iterative or ongoing adaptations over time. I'm not sure how that always plays with review groups. I think that can still create some problems about people thinking, particularly traditional clinical trialists, thinking that messes up the protocol there. I will note, Borsika and I were going back and forth, and there was, I don't know if it was confusion or what, but going on at the same time as this issue was another special issue in Frontiers, co-edited by Maria Fernandez, Byron Powell, and I apologize, a colleague from I think the Netherlands that I don't happen to know, on the use of implementation mapping to guide adaptations at that time. So again, the focus was a little better, more the guidance. And I guess that's maybe one other notion I'd see focusing on that. But I'll shut up there and just ask others to kind of just kick off, or kind of what do they see? Kelly has her hand up, Borsika.
Yes. Yeah, thank you so much, Kelly, please.
Yeah, just to maybe react to what Russ was saying, but I'll share a very concrete example of what's happening with reviewers. I just had an NIH R01 with Steve Bartels and Doug Luke from Washington University, who study sustainment, reviewed, where we are with data following up from a type 3 implementation trial. We're going to study the DSF, the Dynamic Sustainability Framework, and we propose to study long-term adaptation and sustainment of an evidence-based intervention that was implemented in 50 community mental health centers. And I'll tell you that, and we use a very rigorous to us design to make what, a conceptual distinction between what's fidelity, what counts as adaptation. We had the DSF conceptual framework laid out with predictor variables, so we were going to be able to look longitudinally. Our grant was scored, but we'll be resubmitting this fall. But a big issue that came up that I don't think is trivial, and we never take it head on when we, start these adaptation process, is so we're following this intervention up 8 to 10 years later after implementation. And the reviewer one said, well, you're going to need to study effectiveness. You can't, I'm not buying this form function, you just adapted, but it still has fidelity. How do we know this still works? Is the main point. And that was one of our, when you discuss the weaknesses in your proposal or the concerns about potential reviewers identify, it's an obvious question. And I feel like, 2 issues came up in our review that I'm very interested in thinking more and taking on. And one is, the reality is a lot, at least in mental health, a lot of our fidelity measures for evidence-based practices aren't good. They weren't developed in a rigorous way. They're used, they're used in a variety of ways in different states. There's no consensus on some of our major EBIs. And so from a starting point, you're already working with a fidelity scale that isn't the best, if you want to conceptually, if you want to be clear about what's high fidelity and how does adaptation relate to that, that's a big issue. And then this issue of, other than hand waving, that is, it's adapted, but the components are still there. How do we take on this issue of, in the end, once you've adapted, and if we say it has to contextually adapt over time to be sustained, what does that really mean in terms of, taking on, well, how do we know the thing is still effective? And does that mean doing another effectiveness trial 10 years later with the adapted form to demonstrate that it's still effective? So I'll just add those 2, I think, are just really big, important issues that as this adaptation work continues, we're just going to have to grapple with, especially as we face, reviewers who may not be as informed or sophisticated as we all are in these methods.
Thank you so much, Kelly. I appreciate that. I think that, I don't know if others have experience using the function and form approach to say that they are maintaining functions and there is no need to maintain form, and whether they had greater success. I know I am looking whether Monica is here, because I know that her work is still very much expanding that area, but I don't think she was able to join us today. I don't know if others have used that. We are trying to use it in our work, but have not submitted a proposal that was based on that. I do think that there is a paradigm shift that needs to happen, because interventions are usually defined by form these days still, and not function. And so that's a change.
I just want to clarify, Borsika, we had preliminary data looking at outcomes in
Yeah.
our, I'm sure you remember that paper where we
Yes.
looked at adaptations and the relationship to
Yes.
health outcomes, but that was during the implementation trial. So the
Yes.
issue with our work is once you're done, how far do you have to go out
Yes.
with your adapted intervention? How long does that last? That you say, oh, even with our preliminary data, these adaptations we're talking about that are Fidelity consistent are related to positive health outcomes. But
Yeah.
the issue here is like, how long does that last from a reviewer
absolutely.
perspective? And I think it is a big issue.
Yeah, I agree.
So Borsika, I can chime in with some unfortunately disappointing or depressing news, and that is even with PCORI, we've encountered some difficulties where, following the PCORI method standards and stating our intervention in terms of core functions and forms, the project officers didn't quite get it, and were encouraging more traditional conceptions of fidelity to form. I've had some success with a couple of NIH and ARC grants where we've used it, but a lot of work to be done. And the comments that I put into chat about the need for some follow-up activity. Kelly, I think a commentary that directly addresses this and points out at the beginning our overall goals and principles, and the what we're trying to achieve by way of scientific validity, and then pointing out how operationalizing those concepts differs for these kinds of interventions. So if we start at a common place, which is we're all interested in the same thing, but point out that following some relatively simple or simplistic rules that apply when you're studying vaccine end up negating those principles for these kinds of interventions, that may help is one element of the multi-component, multi-level, multi-stakeholder campaign that's needed in order to, as I said in chat, make the world safer for those of us who, do as we feel, get it, and want to do this work in this way.
Thank you so much, Brian. That's well, a set to hear for the first part, and very good advice for moving forward. The only commentary that we invited was David. We had one that we were able to invite without payment. It's really hard to. That's one of the things with these paying special issues, which is more of a logistical piece, that they don't allow for many unpaid commentaries, and so we were limited in that. But I think that getting more of these recommendations, future steps, would be very helpful.
And data. All the commentaries in the world are important, but we need data. We need people to go out and take on these empirical challenges and address and show a link if you can, even if it's just a mixed methods. I don't know, some type of way of following up on the adaptations and taking on this issue of outcomes. Like the commentaries are helpful, and the DSF is helpful for framing, but if we're not applying that and trying to empirically study, it doesn't help us if you're in the front writing these grants and trying to read the research. So even preliminary data, people can contribute. I think that would be super important.
Thank you so much, Kelly. Very important. Okay, I'm looking. Are other thoughts about the special issue topic or next steps? I would say let's do another 2 minutes, 3 minutes, but then open it up broadly about work that you are currently doing in the field. We would love to hear about that. Russ, I'm looking at your comment. Fidelity to what? Effectiveness or impact on what? Yes.
Well, I have a question for the group of editors, if others don't. We talk about this notion of adaptations to the intervention, to the implementation strategy, or the context. I'm wondering, how much did you get in terms of focusing on actually adapting the context? And I'm just wondering that. I see a lot more myself on the first two issues. I've seen a few things recently, not part of this issue, I don't think, but on kind of trying to help enhance readiness for change, if you will, recently in the literature, but I just haven't seen as much on that. And I just wondered if you would reflect how much you saw that in these papers.
Let me see if I can see if Marina, I don't remember if you used that as one of your abstraction criteria of looking at if the adaptation was for the intervention, implementation, strategy, or context.
I believe though it was. I'm just trying to find that.
Super. Thank you so much. While you look at it, I would say, Russ, that I have looked at them kind of more on a superficial level and looking across at this point. And I do know that some of the iterative PRISM and REAM work, we are not differentiating whether the change needs to happen to the intervention, the strategy, or the context. We are thinking about action planning, and whatever needs to be changed to make the alignment better, we'll take it. So I think that that is an example where the focus is not on changing one thing, it's the increase of alignment and, you know, getting partner input from what needs to happen for that to be better.
I think on Marina, your slide about adaptation categories, I think I can share that again, where you have mentioned adaptation to the various aspects, including to the healthcare delivery, to the format, program components, and then implementation strategies. These were some of the things that we saw, but also things that were informed by context.
Yeah, that's a good one. Thank you so much, Roman.
Not to go down a rabbit hole on that, but I appreciate that and the response. And I think this is kind of a dominant theme, I think, to go back to the earlier question Brian asked about, you know, aligning with context and aligning the intervention, the implementation strategy to the context. But I'm just wondering about actual work to try and change the context there. And it's, I think, an interesting issue, particularly when we think about formulating proposals or programs or whatever, a balance between, you know, doing this in contexts that are, quote, ready and have sufficient resources and things that the program has a chance of working versus not like contributing to inequities and things in terms of not dealing with places that are quite as ready to do that or as sophisticated or have all the support and things there. And then in the latter, just thinking about if there's either evidence or strong conceptual reason that things you think are necessary, then trying to work with those multi-level, you know, settings to adapt the context. And I just wonder if people have any other thoughts. I just mull that over a lot.
Thank you so much.
Sorry, I just I did locate that manuscript that was addressing that, and just wanted to mention real quick the specific manuscript is sexual and gender minority cultural humility training for oncology providers, and their focus was on how do we adapt the context of the practice, you know, to account for that. So,
thank you so much, Marina, for finding that. I think that we can, if everyone is okay with it, I'm going to open this up for broader discussion now because we have still about almost 20 minutes and we would love to hear about your work. I did want to say, Elizabeth, you asked about the metrics. These are available actually, at least on my side, I can see the impact. I don't know if you can see it as well. So if you have a special issue that you are running through Frontiers, they provide you with the impact scores. And I thought that that was fun too. Bob, can I ask you to share a little bit about what you said? Because that could be the first step of sharing of work that is being done by our members. It looks like you talked about the fidelity questions that you are trying to address.
Yes, thank you. The program that we're trying to implement is an ECD program with a strong fatherhood component. You know, and it's a scale-up program in about 6 regions of Uganda, 6 cultural regions, and because it's what you're trying to address is male caregiving and health-seeking behavior and child health issues. We found out that social norms, are some of the barriers. It's one of the key barriers to this, poor health outcomes for child health, but also limiting male caregiving. So we, based on an exploration, we propose that we are going to conduct a thorough study and then infuse norms change and transformation messaging and components within the entire curriculum of the Real Fathers program. But we got, many questions, many of which we didn't have answers. And some of the, experts were saying, so if you add, social norms change components in each of the modules, the community modules, is it not going to change the entire model? Will it still be a mentorship model, because now you're bringing in a community sensitization component, you're bringing in a social behavior change component? So we didn't have a clear answer, because we knew the model is tested in terms of effectiveness, but they were saying, how sure are we that if we add this, it will still be effective as tested initially? So we actually are still at that point where we are saying we're going to implement and adapt and learn, capture as many learnings as possible to kind of convince people that actually the program can have better, childhood development outcomes, better than the initial pilot. So I think when it comes to Fidelity, there were a few things that the originators didn't want us to touch, like the community sensitization approach, how it was done initially. So when you touch it, you're touching a core aspect of the model. Yet the results were telling us that we need to do something about the norms. So I think managing fidelity versus, and like Ross was saying, adaptation, as long as it's for us, as long as it's causing improvement, as long as it is making sense, as long as there is evidence that norms change, improve outcomes, we thought it was working, but not everyone was thinking that way.
That is such a great, thank you so much for sharing. And it's a major, I don't know, I don't want to say anything, actually. I want to open it up for others to comment, because it is a critical question that we struggle with, many of us. Let's see if others had immediate reaction. Kelly, actually, may I reach out to you? Because I remember that you found in your study that you had to change core elements, right? Is that, do I remember correctly that you had to?
Yeah, but I'm just wondering, was this Bob who just shared his example?
Yeah.
I was just wondering, I was trying to sort out, Bob, you said this is a pilot study though. Like, so what phase of science? So it's also like, what phase is it? Where is the intervention? Like, where is it in the intervention we studied had already had 2 prior RCTs, like evidence of effectiveness in the real world from 2 prior RCTs when we started studying adaptations, and it didn't change any of the core components. Anyway, so it always, when I do a lot of consultation through our various centers, and it's interesting to me to think about when people start talking about adaptations to something, like how strong actually is the evidence for what they're saying is evidence-based. Is it, Bob, like, can you tell us more about the state of the science around the intervention? Because I think that's important for then these questions around fidelity and what, where you study effectiveness, because we don't always talk about that either. What's the evidence for the thing we're adapting, which seems really important in these, when we're designing these projects. Bob, you mentioned it was like an
Yeah.
evidence-based intervention, and then there's like a component you're enhancing with. Is that it? Can you tell us a little more about the evidence for the intervention?
Yeah, it actually has evidence. You know, a trial was conducted, a clinical trial was conducted. It has been adopted even in several countries. Yeah, based on that evidence and additional evidence. You know, in terms of adapting it to Malawi. Now it's in India. If you search the Real Fathers program, you land on it. So there is evidence. Yeah, that was generated from 2013. And also an expansion tested in 2018 to see how it could be implemented by scale. So it went through all the stages, you know, proof of concept, RCT, implementation, evaluation. So
I'll just say one thing. To me, it seems like so you already have an evidence-based intervention, and if what you're doing is enhancement, really adaptation, but it's like an enhancement to it. It's not changing what's core to what was in the evidence-based, you know, that generated the evidence base for this intervention. It's like, why do we want to slow progress so much by requiring people to do, you know, additional efficacy or effectiveness testing before something gets implemented? So to me, it seems like that key issue is as you were just saying, you know, the arguments around, well, this is something that's, you know, enhancing, and if you are able to collect some data around showing that it is enhanced, but it hasn't changed what's core to the evidence base and maybe even made it better, that seems really important.
Thank you so much. I am thinking, Bob, this might be an interesting discussion. If you would like to talk about this with us more in a broader discussion, please let us know, email us, and we could bring it in. I did want to open it up for others to share what kind of current work they have in adaptations, fidelity, and tailoring. And then we could kind of go from there. We have a few more minutes, so I would love to hear from others. And I'm also looking at the chat.
So, Borsika, I can be very, very brief. Thanks for the shout out earlier. You know, in addition to being very interested in how others have, you know, developed and then used core functions and forms, and someone needs to go back and do a review of, you know, all of the articles that have been published following Monica's paper to see, you know, how, you know, what kinds of tools and approaches have been used. My, you know, key focus lately is on trying to link this work to broader questions of societal and policy practice benefit of our work, and pointing out that, you know, if we are going to provide more near-term guidance, we need to, you know, as you said, and I've said before, embrace and guide adaptation rather than try to suppress it or ignore it.
Thank you so much, Brian. That's great. Others? Andre? Is it Andre?
Hello.
Hi there.
My name is One.
Okay.
I'm a graduate student at the University of Washington. I'm currently working on a project in Mozambique, my home country. It's called Systems Analysis and Improvement Approach to improve hypertension care cascade outcomes for people living with HIV. The PI is Sarah Gimbel from the School of Public Health Nursing in the UW. So what I'd like to share is more around fidelity than adaptation. Just quickly to say, the study is a systems level study implementing the SIAS strategy at health facility level. It's basically like quality improvement cycles, and we use cascade analysis to diagnose health facility performance, and then quality improvement cycles informed by that performance analysis to see if solutions that the health facility team is implementing are making changes and improving the proportion of patients that successfully go through the cascade, from being screened up to attaining blood pressure control. In terms of fidelity, or in context of a qualitative analysis, trying to understand like the determinants for success of this of adopting the SIAS strategy, we had initially thought about comparing perspectives of providers in high performing versus low performing facilities, right? And the way we're going to define high and low performing was fidelity, quote unquote, in terms of how many quality improvement cycles they were able to implement. So the more, if they, those who implemented more quality improvement cycles as expected in the protocol, we would be like, okay, those were more faithful to what was expected. And then dividing those groups to see if, what were some drivers for implementing more or less, and then use that information to understand really if those core components of the intervention were maintained and what drivers influence using them or not. What we found, this is a cluster randomized, parallel randomized trial, by the way. And what we found is that both control, every intervention site implemented the number of of quality improvement cycles that we needed to implement. So there was no variation there. So I'm trying to think what other approaches I could use for assessing fidelity here. And what I'm coming up with is just to look at like Proctor's intervention strategy specification, like who's implementing temporality. I mean, all those elements. But the big question mark I have right now is when I'm trying to build scores for those elements that specify the strategy, do I put them with the same weight? So who implements, how was the temporality, what was actually delivered, do those elements have the same weight when we're looking at fidelity implementation, or should we think about giving them different weights? So that's like a big question mark that I'm still wrestling with, and I just wanted to share, to bring that.
Thank you so much. Very, very interesting work. I know that today we cannot necessarily solve it, but if you would like to, again, bring it back to this group as you are working through it, please do, or separately just send an email. Very intriguing, and I know Sarah's work, so it's fun to hear about how it's evolving. So thank you so much for sharing.
Absolutely. Thank you for the opportunity.
Thank you. Anyone else would like to share about their work? And I'm also, again, please look at the chat.
Hey, I'm
please,
Robert. I haven't really
Robert.
been able to say much because I'm still, I think I'm the relative newbie, still very much here. But my work is centered around adaptations to psychosocial interventions for delivery by non-expert providers, i.e. the task sharing and task shifting stuff, as well as what are the implementation strategies to support those, and how do we adapt those in those settings and for those individuals. So that's the kind of stuff I'm doing. It does bring up another impossible to answer question quickly, but one that I struggle with is, particularly, I know this is not a cognitive behavioral therapy, group per se, but it's a big focus. And, when we have something like CBT that's so multi-component and no one can seemingly agree on what's the functional part of the intervention, how do we adapt the thing when we can't all agree on what's really core to the intervention? So those are some of the things that interest me.
Thank you so much. Thank you for being here. We might have one more share time if anyone else would be willing to share what they are working on right now. Well, that's fine. I think that we can do this again another time. If we have a shorter presentation, we can always check in. I love to learn about, because we have actually multiple newer members over the past year. So it's really fun for us to understand why you are here and what kind of areas are most interesting to you. Also, feel free to send us a message, and perhaps, Kara, you can drop in one more time that link where people can submit recommendations, either a publication that you would like us to discuss as a group or your own work you would be willing to share. We have used this in a platform of WIP, so if you have just an early idea, that's also appropriate. And anything starting September is open for now, so we would love to have your work presented. Any other questions or thoughts for today? Thank you so much. I really appreciate it, Kathy, Roman, and Marina.